I'm Harriette Van Spall, and I'm delighted to have with me Professor Jim Januzzi from Harvard Medical School. We are here at HFA 2023 to discuss his TRACER-HF trial. Welcome.
Thank you. It's good to be here.
Tell us about the rationale for this trial.
Yeah, so this is an interesting subject. It's been found in experimental models that copper depletion, like some other trace minerals like iron, may be associated with myocardial dysfunction. And in addition, restoration of normal intracellular copper concentrations is associated with reverse remodeling and prolonged survival in heart failure models. Mm-hmm. The issue is that until recently, there was no therapeutic that could restore normal copper concentrations within cardiomyocytes until the discovery that this drug, trientine hydrochloride that we examined, could actually do this process.
So was there any background evidence that informed this particular phase 2 trial?
Yeah, so animal model data only, non-human primate data as well. But here's the thing, rather than going to phase 1 to examine potential safety in humans, trientine's been used for more than 40 years to treat Wilson's disease.
Yeah.
Yeah, exactly. So that's at higher doses where it binds and removes copper from the body. But at lower doses, trientine has this unique copper chaperone effect where it binds cupric valence copper and brings it intracellularly.
So tell me about the eligibility criteria and the study design.
Yeah, so we studied heart failure with reduced ejection fraction. These were patients with symptomatic heart failure with an EF 40% or less and an elevated NTproBNP.
Okay.
We randomized them to placebo or 3 ascending doses of trientine. The goal of TRACER was to identify a dose. So we looked at 50 milligrams, 150, and 300, and we followed them for 12 weeks in their various study arms to do a number of different examinations, the primary endpoint being the proportional change of NTproBNP from baseline to 12 weeks.
And what were the study results?
Yeah, interesting results in a few ways. One is the primary endpoint was not positive by 12 weeks. However, at 4 and 8 weeks, there was a 20% reduction in NTproBNP in the 300 milligram arm. By 12 weeks, however, that difference was no longer evident. However, in the secondary endpoints, including reverse cardiac remodeling, 6-minute walk distance, and health status by Kansas City Cardiomyopathy Questionnaire, there were all improvements favoring the 300 milligram dose. Lastly, and interestingly, we found a baseline interaction by ejection fraction such that EFs less than 30% at baseline showed a striking impact on the NTproBNP, as well as we will present in later meetings, a substantial impact on the secondary outcome measures.
So mechanistically, is there a reason why you had this treatment effect earlier on and that got attenuated at your primary endpoint time point?
Absolutely, great question. We don't have mechanistic explanations as of yet. The one thing I will say is it may not be a mechanistic issue. It may be a trial issue. TRACER-HF was performed mostly in China because of difficulties enrolling during the US part of the COVID pandemic. We pivoted to China enrollment where patients were not pulling back from study visits. But unfortunately, at the end of 2022, there was a massive surge of COVID-19 in China that affected many of our study participants. So one possibility is that it may have resulted in patients missing follow-up visits or stopping the investigational product.
And do you have data on that?
We're working on it right now. We've looked at a number of different ways, but the ultimate way is to look at the PK data, the pharmacokinetics data, where we actually are measuring trientine concentrations. So we'll be able to get a sense of whether or not there was a tailing off later in the study.
Fantastic. Well, thank you for dropping by and discussing this fascinating phase 2 trial with us.
Thank you. Really
lovely to see you.
You as well. Thanks.